Welcome to Rwanda Medical Academy. Today's lesson is about mastering substances that can cause hypothermia. And we will use COOLS mnemonic to help master well all those causes. Introduction. Hypothermia, defined as a body temperature below 35 degrees Celsius, 95 degrees Fahrenheit, can result from exposure to cold environments or certain substances. Understanding the substances that can induce hypothermia is crucial for healthcare professionals to provide appropriate management and care for affected patients. The COOLS mnemonic is a useful tool for remembering some of the key substances associated with hypothermia. Now, let's explore more in detail each component of COOLS mnemonic. C stands for carbon monoxide. Carbon monoxide, CO, is a colorless, odorless gas produced by incomplete combustion of carbon-containing materials. Mechanism: CO binds to hemoglobin with much greater affinity than oxygen, leading to tissue hypoxia and impaired thermoregulation. In this scenario, hypothermia occurs due to reduced cellular metabolism and impaired heat production. O stands for opioids and oral hypoglycemics. 1. Opioids. Opioids, such as morphine, heroin, and oxycodone, can depress the central nervous system, leading to respiratory depression and hypothermia. Mechanism: opioid receptors in the brainstem regulate respiratory drive. Suppression of the respiratory center can decrease metabolic rate and contribute to hypothermia. Clinical presentation: patients may present with bradypnea, pinpoint pupils, and decreased responsiveness, along with hypothermia. 2. Oral hypoglycemics and insulin. Certain medications used to treat diabetes, including oral hypoglycemic agents and insulin, can cause hypoglycemia, leading to hypothermia. Mechanism: hypoglycemia impairs glucose utilization by cells, reducing energy production and metabolic heat generation. Clinical presentation: symptoms of hypoglycemia, such as confusion, diaphoresis, and tremors, may accompany hypothermia. L stands for liquor, alcohols. Consumption of alcoholic beverages, including ethanol, methanol, and ethylene glycol, can lead to hypothermia through various mechanisms. Mechanism: alcohol impairs thermoregulatory mechanisms, dilates blood vessels, and increases heat loss through the skin, contributing to hypothermia. Clinical presentation: patients may present with decreased consciousness, hypotension, and bradycardia, in addition to hypothermia. S stands for sedative-hypnotics. Sedative-hypnotic medications, such as benzodiazepines and barbiturates, depress the central nervous system, potentially leading to hypothermia. Mechanism: these medications enhance the inhibitory neurotransmitter gamma-aminobutyric acid, GABA, leading to decreased neuronal activity and metabolic rate. Clinical presentation: symptoms of sedation, including drowsiness, confusion, and ataxia, may be accompanied by hypothermia. Conclusion: the COOLS mnemonic provides a structured approach to remembering substances that can induce hypothermia. Healthcare professionals should be aware of these substances and their mechanisms of action to recognize and manage hypothermic patients effectively. Thank you for learning. Join and save a life with us at Rwanda Medical Academy.